This video is the third in a series about preparing for Medicare. As I noted in the first video of this series, Original Medicare consists of Part A and Part B. This video focuses on Part B, which covers inpatient doctor fees and some other costs. Part B covers medically necessary costs for doctors, outpatient care, home health services, and durable medical equipment. Medicare Part D differs from Part A in terms of cost. Most notably, enrollees pay a monthly premium cost, whereas most people don't have Part A premiums. In 2020, the standard Part A premium amount is about $170. However, it can be more depending on income. If modified adjusted gross income on your IRS tax return from 2 years ago exceeded $91,000, then the monthly amount could be anywhere from $238 to $578. Part B premiums are deducted from Social Security benefits. For Medicare enrollees not receiving Social Security, a monthly bill is payable through check, credit card, and other methods. For other costs, such as deductibles, coinsurance, and copayments, these apply for healthcare services rendered under Part B. For example, the 2020 Part B annual deductible is $233. Once this is paid, coinsurance kicks in at 20%. Therefore, the enrollee is responsible for out-of-pocket costs of 20% of qualified healthcare costs after the deductible, although some preventative services have zero deductible or coinsurance. It is important to be aware that there is no annual limit on what enrollees pays out of pocket for Original Medicare. However, other types of coverage like Medigap, Medicaid, or Medicare Advantage may provide caps on the annual amount paid. These subjects are covered in other videos in this series. Medicare Part B covers a wide range of healthcare services and products. However, coverage only applies if the provider accepts assignment. Assignment is another important Medicare term. This means accepting the Medicare-approved reimbursement amount for a service or product as payment in full. This aids enrollees in the form of lower out-of-pocket costs. However, not all providers accept assignment for all services covered by Medicare. Some may accept assignment for some services and not others. These providers are considered non-participating. A possible impact could be that the enrollee pays all fees up front for Medicare-covered services and then applies for Medicare reimbursement. So what specifically does Medicare Part B cover? I have already mentioned these broad areas: doctors, outpatient care, home health services, and durable medical equipment. Let's look at each individually. First, doctor fees. The list of services and products covered in this category is extensive. Especially important are preventive services. These are services providing the dual benefit in maintaining a higher quality of health for enrollees while simultaneously lowering costs for Medicare. Examples of preventative services are annual wellness checkups, cancer screening, cardiovascular disease screenings, depression screenings, mammograms, nutrition and obesity screening and counseling, shots like COVID-19, flu and hepatitis B, and tobacco use cessation counseling. Again, these are only a few examples of preventative services. Medicare Part B covers many other costs, preventative and otherwise. In fact, the Part B section in the Medicare and You Handbook from the U.S. government devotes 24 pages to items covered under Part B. Next, let's look at outpatient care. While Part A covers inpatient care, Part B covers outpatient services. Many types of services can be delivered in an outpatient setting. For example, mental health needs are covered under Part B outpatient services. Examples are counseling or therapy done in a provider's office or hospital outpatient department with such professionals as a psychiatrist, a clinical psychologist, or a nurse practitioner. Next, let's look at home health services. Like Part A, Medicare Part B covers some home health care costs. Examples are part-time skilled nursing, therapies like speech, physical or occupational, home health care aid, and durable medical equipment as ordered by a doctor. For Part B, Medicare Certified Home Health Agency must provide services. Also, a doctor needs to have a face-to-face visit to certify that the enrollee needs in-home health services. Finally, let's talk about durable and medical equipment in a little more detail. Common examples of DME are wheelchairs, walkers, hospital beds, power scooters, and portable oxygen equipment. Medicare Part B will cover medically necessary, that is, doctor-prescribed, durable medical equipment and other medical supplies for use outside a hospital or skilled nursing facility. Part B deductibles and 20% coinsurance apply, assuming that the DME supplier accepts assignment. DME can either be purchased or rented. As you can see, Medicare Part B covers a lot of things. However, some new enrollees are surprised to discover some things are not covered. Examples are normal vision, hearing, and dental care services, including routine checkups and items like eyeglasses, hearing aids, and dentures. Home safety products like grab bars, stair lifts, or medical alert systems. Sometimes Medicare will cover things like a lift seat to get up from a chair. Custodial care in a long-term care facility. In these situations, Medicare covers medical needs, but not help with daily activities like eating or dressing. Cosmetic surgery or gym memberships are not covered, and except in unusual situations, medical services outside U.S. territory are not covered. I hope this information about Medicare Part B has been helpful.